My name is Dawn Bessarab and I'm a professor and the director for the Centre of Aboriginal Medical and Dental Health, which is based in the medical school at the University of Western Australia. And CAMDA is housed in the Billy O'Malley building, which is the School of Indigenous Studies on the second floor.
What is your relationship to the Working Together book?
Well, I'm one of the authors in the book, and I worked very closely with one of the editors, Pat Dudgeon, and some of the other authors on the chapter that I worked on. And at the time, mental health was very much, and social and emotional wellbeing were very much at the forefront of conversations around what was good and necessary for working with Aboriginal people.
What were the circumstances like when you co-authored the book? Like if there's any anecdotes, stories, reflections?
Not anecdotes, but I think for me it was the first time that I'd worked on a collaborative chapter with a range of different people, and some of them, and it was working not face-to-face, but we didn't have online back then, but working through emails, etc. So it was a really interesting exercise of coming together with different authors and working out, how we were going to do the chapter and whose role, who would do what, and what each one of us would bring. So it was, I think, one of my first exercises of working collaboratively on a piece of written work.
Do you remember some of the people you collaborated with, some of the other authors?
Yes, Ros Walker, and I still do stuff with Ros today. Rhonda Marriott, and I've worked with Rhonda Marriott, in the last couple of years. Clinton Schultz, not so much, but he was the first author.
So the second edition was published in 2014, so 10 years ago. What was the discourse around Aboriginal and Torres Strait Islander mental health and wellbeing at that time, and do you think it's changed in the intervening 10 years?
It's a really interesting question. I mean, the discourse at the time, there was a lot of work being done and discussed around the importance of social and emotional wellbeing and its impact on Aboriginal health outcomes, and particularly its importance in working with mental health. So that was that conversation was starting to get some momentum, and the importance of mental health was starting to be given a lot more focus and attention. And I think that was one of the reasons which led to this book being a second edition, was to now focus on mental health. And also social and emotional wellbeing was very much linked to the importance of cultural considerations. So we know the social determinants and the political determinants that impact on Aboriginals people's health and well-being. So mental health is also the impact of trauma and colonisation. I think in terms of trauma, that wasn't really at the forefront as it is today. Like, there's a lot of conversations now being taken around post-traumatic stress and the impact of intergenerational trauma, which makes the relevance of even what was written back then still very relevant today.
What themes, issues, topics did you write about in the chapter that you worked on?
Our chapter was about interdisciplinary work, because at that time it was kind of working, there was a movement away from multidisciplinary teams to the consideration of interdisciplinary teams within the health sector. And the difference between the multidisciplinary and interdisciplinary teams, and the chapter goes into explaining the difference, was that in a multidisciplinary health team, you've often got the head of the team is usually the doctor, the clinical, and then it's a hierarchical process, and the team then discuss, what the health issue is and give their input in relation to the client or the patient. Whereas interdisciplinary doesn't assume a doctor as the head of the team, but the head of the team can be taken over by any health professional who, in relation to the health issue that's being discussed. And I think it tends to be a lot more equal, and that it brings in the skill sets of everyone who may have something to say in relation to the patient's health issues. And that's really important in relation to, particularly when we're talking about Aboriginal people, mental health, because on the interdisciplinary team you may have Aboriginal health workers or an Aboriginal liaison officer, and often their voices aren't heard in the mix of in a multidisciplinary team, because it's usually just the clinicians that get to have an input. Whereas in an interdisciplinary, if it could be the issue could be a cultural issue. If we're talking about a mental health issue, it may be that the patient is experiencing something which is could be part of a cultural explanation, and that's where the Aboriginal health worker or Aboriginal liaison officer may then be consulted or referred to. Can you provide some insights into what's going on, and how do you think we should work more effectively with this patient? So the chapter really did explain a lot more clearly what the differences were and why that's important. The other thing that I noticed in the literature around interdisciplinary teams is that, and in talking to health clinicians out in the community or working in hospitals, is that often the role of the social worker, I'm a social worker, and often the role of the social worker is missing. And yet we know that social workers are often called upon within hospital settings to assist patients, with psychosocial issues or welfare issues or things like that. So it was important. And the other thing that was missing is the role of the pharmacist, because in relation to medications, often the pharmacist was left out of those conversations, when in fact they have a very important role, because they know about the drugs, and if you're changing the medication, what that could mean if someone's already on medications. So in this chapter we made sure that there were key professions that were included, such as the pharmacist and the social worker. So there's a section in the chapter which has a table on showing who may be part of an interdisciplinary team in healthcare.
What do you think the impact of the Working Together book has been?
Oh, look, it's had an amazing impact, because I teach Aboriginal health, and I also often will go out and do community lectures or community presentations, and I've referred to the book, and the amount of requests that I've had over the years for students, for health professionals, for community workers contacting me to ask where can they get a copy of the book, and do I have a copy. And some of the hard copies that I've taken along and left on the table have very quickly walked. So now I make sure that I still have copies. I have one set on my shelf which I don't share, because they're now not as easy to get hold of as they used to be. I mean, they were available online, and that was great, because we were able to refer people to online and to get it printed out. But it's had an incredible, and also not just an impact, but a spread. Not just within Australia, but I'm sure that it's also had an international impact. Because the chapters are wide-ranging, but they're very good chapters, because it's all around the context of Aboriginal health, and people were wanting to know about that. And the chapters enable people to engage and to be able to see, how that can inform their practice. It's an easy read.
Are there any ways of thinking or models from the book that you would like to talk about more, or you think were particularly pioneering or are even more relevant today? Oh,
well, the chapter that Pat and Graham G and I can't think of all the others because there's a lot of authors, but I know Pat and Graham G were some of the key authors, did around social and emotional wellbeing, the social and emotional wellbeing wheel. We use that still today in our lectures with our doctors, trainee doctors, around explaining the importance of SEWB, and that model has become very familiar and well known across the sector, because it's really easy to engage with and to explain the different impacts on someone's social and emotional well-being, their mental health, their psychological, which is your mental health. So that model has had very big usage and is still very relevant today.
Do you have any thoughts for the upcoming generation of health workers, academics, researchers or writers?
I think that, you know, even if you're, for non-Indigenous students, upcoming future generations, workers, practitioners, even though these books are starting to become a bit dated, they're seminal, you know, and the issues that they're talking about haven't really changed. You know, while we may have made some progress, we've also gone backwards a little bit. And, you know, there are still the issues that we talk about in the book and that are addressed in the book are still happening today. So I think if they're going to be a really good practitioner, they need to be well informed and versed about what it is that they're talking about, and helping them to identify what it is that they're encountering in their practice. And if they don't know, then, you know, to consult some of the seminal literature, which is easy to engage with, around becoming more culturally informed in relation to working with Aboriginal people, particularly in the area of mental health. There's a lot of conversations today around healing programs, and the government is looking at releasing funding to run healing programs in the Aboriginal community. And this is where, you know, some of these chapters can still be very relevant. So I think the message is that just because the books may have been published some years ago, not to dismiss them, because they're still very, very informative and can help people in their practice.
Anything else you want to talk about or say?
Well, I think that this was an incredible project for Pat and Roz and Helen, who were the editors of the book. And, you know, being able to pull together a whole list of different authors across a range of different chapters was not a mean feat. You know, getting people together, getting them to submit their chapters on time and to work together is really something they should be commended on. I think they did a great job, and I mean, I was even thinking, is there going to be a third book? I'm not sure, but I know people are asking, is there another edition of this book, a third edition coming out? So that might be something to think about. But yeah, it was a great idea, and I think it was one that was well received in the community, both the community and the professional community. So well done.